Hi, we're here with Dr. Fairoz Miller, who's a GP actually in the Wirral, and she's been working as a GP for the last 6 years. But Fairoz is quite progressive because she's willing to take on new kinds of therapies and bring those into her normal practice. So she's got training in things like neurolinguistic programming and coaching and acupuncture. And she uses those skills to help her patients. And something else that she's been working on more recently, I think for the last 6 months or so, is something called dermarolling. So yeah, I'd never heard of dermarolling, so I thought it'd be great to speak to her and find out a bit more about what dermarolling is. So hi Fairoz, how are you?
I'm fine, thank you. How are you?
Yeah, I'm good. I'm good. So thanks for taking the time to talk to us. So I've never heard of this before. What is dermarolling?
Dermarolling is actually an extension of acupuncture. It's also called facial microneedling, and basically the process involves using fine needles around about 0.5 millimeters in depth, which are rolled over the skin. And this does this does two things. It induces small channels, microchannels into the skin, which increases absorption of anti-aging sera or healing sera that you apply to the skin. And the other thing that it does is that the needles penetrate just below the skin surface into a layer called the basal cell layer, and at that point you're actually stimulating collagen production. And because it's rolled over the whole surface of the skin that you're treating, you get a nice even layer of collagen production.
Right, okay. And collagen is that part of the skin that keeps the skin from going too saggy, is that right?
Yeah, that's right. Yeah,
Okay.
you want a really nice collagen layer.
Okay. So these needles, I mean, do they hurt?
I mean, the needles are very fine and they are very sharp. So, strangely enough, because they're so sharp, the procedure is I'd say uncomfortable the most. It's a little bit more painful in the more sensitive areas like the nose and the upper lip. I've chosen not to use local anaesthetic gel, which some practitioners do use, because I believe, and there are studies to show that if you actually numb the skin, it reduces the healing reaction and therefore the collagen production. And the other problem, which I wanted to avoid, was actually not increasing the absorption of the local anaesthetic agent, because obviously if you're introducing fine pores, you're going to increase absorption of anything that's applied in the skin. So I wanted to avoid that. So at most I say that the procedure is uncomfortable.
Okay. And how long does the discomfort last for?
Or the discomfort is gone almost immediately as you take the rollers off the skin. You can get a little bit of facial flushing, and so the skin starts sort of glowing, but that lasts maybe 20 minutes to an hour or two, and then that settles. So you're able to go out in the evening without any problems, really, if you had the procedure done in the afternoon.
Okay. And so I'm a bit of a chicken when it comes to needles, but there's no bleeding or anything like that then.
Bleeding doesn't happen. I mean, occasionally you get a little bit of pinpoint of blood, but nothing, no bruising at all.
Right. Okay. And so it's relatively safe, but does it work?
Clients will notice an immediate difference in their skin. Again, as I said, it will flush, and then the next day you'll find that the skin feels a lot more firmer, and also there'll be a sort of a glow about your skin. So you will notice an immediate difference. To maintain this, you do need to repeat the procedure, probably 2 weekly, so that you get a long-lasting effect.
Okay. And how long would you need to repeat the procedure for? So every 2 weeks forever?
Well,
Or?
ideally, you'd want 6 treatments, but at least a minimum of three. So 3 treatments or 6 treatments separated by 2 weekly intervals.
Okay. So after, let's say, 3 months worth of treatment, is that it?
Yeah,
Can we
the
go?
effect should last 4 to 5 years. They reduce the appearance, the treatment itself reduces the appearance of fine lines, any scarring, especially good for acne scarring.
Right.
So
Okay.
it lasts, as I said, lasts 4 to 5 years.
Wow. And does it work for everyone?
It works for the majority of people, but there are certain categories of people that have to be a little bit more careful. Obviously, if there's an infection on the skin, you wouldn't want to spread the infection, so it's important that the skin is clear of any sort of spots or any sort of what we call infected areas. The other group of people that have to be careful are those that have a tendency to have keloid scars, and a keloid scar is a especially built up scar. Now, not everybody has that problem, but there are certain groups of people that do, and if they've got a history of that, although the risk with dermarolling is only theoretical, I'd probably avoid doing dermarolling for that group of patients.
Right. Okay. And obviously there are no chemicals here, are there, or are there?
There's no application of any chemicals. It's just the insertion of these needles, which are taken out immediately. There's no chemicals that are left in the body, and because I don't use the local anaesthetic, there's not even the local anaesthetic application.
Okay, so it's a bit like sort of a facelift without surgery. Is that how it is?
Absolutely, yeah.
Right. Okay. Well, that sounds great. I've never heard of this. So, if I wanted to find someone who was able to do this for me, where I live, what advice could you give on how I might search for someone who could do a dermarolling treatment for me?
I mean, for me, what I would want is to make sure that the practitioner is properly trained through a reputable institute, has got ideally some acupuncture experience and also experience of dealing with people's skin, really. You want to make sure that there aren't any conditions which can make things worse. For example, I had a client who had a very minor skin infection, but it was actually all over her face and her chest and her arms. It's a very minor folliculitis, and I did suggest to her that we actually delay the treatment until she'd got some antibiotic treatment so that we'd lessen the risk of infection.
So make sure they're properly trained.
Make sure they're properly trained, and also make sure that that you can get on with the practitioner, and also that they arrange some follow-up so that you can feed back any concerns that you have, any problems that you've had, and also just to help them with their learning, really, so that they're open to feedback.
Right. Okay. Great. Okay. And so, Dr. Miller, if someone wanted to sort of get in touch with you, and they phoned you up, what might happen next? What would happen after that?
So with myself, you would be speaking to my receptionist, who's a trained nurse. She'd take your details, obviously, and also go through some brief questions just to make sure that there aren't any immediate problems with having the treatment done. She'd also ask you about any medication that you were on, and also about what expectations that you had. She would then arrange a consultation with myself.
Okay, and how quickly would I see you after you've arranged a consultation?
I run weekly appointments, and obviously it depends on the time of year. Around Christmas, obviously it's busier, and the holiday period. But you'd see me within 2 weeks, and you would have a initial consultation where I take a full history and do an examination, paying particular attention to the condition of the skin and the areas that you wanted treating, making sure that you've got, we had realistic expectations of whether the treatment was right for you. I'd also make sure there weren't any pre-existing medical conditions which may cause problems, such as a keloid scarring or an infection, and also make sure the medication that you're on is not going to interfere with the dermarolling or cause any problems. The dermarolling won't cause any problems. I'd offer the treatment. The initial treatment would actually be free, so that you were comfortable with it and you would have full confidence in myself. The other thing that would be really important is that I'd offer a follow-up appointment where I would actually make sure that you were happy, and perhaps if you wanted to book further treatments.
Wow. Okay, so that sounds quite appealing, and obviously with you being a trained doctor and having a health background, I suppose it keeps it very safe, doesn't it? Do you know, if someone wanted to get in touch with you, Dr. Miller, what would be the best way for them to do that?
The best way would be to contact my receptionist, Tracy, who's also a trained nurse, and the number to contact me on is 0151 528 2144. If for any reason you weren't able to speak to her, don't hesitate to leave a message and she'll get back to you. Great.
Okay. It's been lovely talking to you, Dr. Miller. Thanks for taking this time to spend explaining to us about dermarolling. I look forward to seeing you again.
Thank you.